Thank you for joining us on our fourth episode of Public Health One-on-One. And today we have Dr. Jason Phillip with us. Dr. Jason is actually a urologist by specialization. He has done MCH in urology. And he is an expert in the field of sexual and reproductive health. And he is currently working in Tamil Nadu in South India. And thanks a lot, Jason, sir, for joining us today.
Thank you for inviting me.
And so 12th of this month is the Sexual and Reproductive Health Awareness Day. And today's agenda of this talk is to talk about this thing which is not commonly talked about, which is sexual and reproductive health, especially in Indian context. It's a cultural taboo to even talk about sex.
Even mention it,
so even mention it as doctors as well, not just as the general public. So just to start off this conversation, how do we define sexual and reproductive health? Are these two things very different from each other, or are they the same?
Of course, they are related. So good sexual and reproductive health is a state of total psychological, physical, personal, relational, cultural, spiritual, emotional, and social well-being in all matters relating to the reproductive system. So adults are not only expected to have a satisfying sex life, but also a safe sex life. They should have the capability and freedom to choose to reproduce. They should also have the freedom to decide when and if to reproduce, when to reproduce, and how to do it. I mean, surrogacy or other things subject to legal laws, of course. And then adults also have the choice to identify his sexual orientation. That's something that is never talked about. I mean, almost never talked about. And he must have a complete freedom to pursue his or her sexual orientation. And every adult has the right to have a healthy body, anatomy, and access to education about normal sexuality, pregnancy, and infections transmitted through sex. So what does the World Health Organization say about sex? It defines sexual health as a state of physical, emotional, and social well-being in relation to sexuality. So absence of diseases comprising sexual health is not sexual health. I mean, so let me repeat it. Sexual health does not mean absence of diseases. So what is sexual health? The hallmark of a sexually healthy person is that he or she respects both his sexual boundaries and also the sexual boundaries established by others. So he respects both his boundaries and the other interlocutor. So sexual health requires a pleasurable and safe sexual experience, free of violence, free of duress, and free of discrimination. I mean, there are a lot of problems in India pertaining to this. So let's discuss.
So like you said, starts right from choosing your own sexual orientation till having a safe sexual practice, which is free from any disease transmission. And so what role does sexual health play in a person's well-being? In your experience, you would have come across people suffering from a poor sexual health. So how has that poor sexual health component alone affected their entire well-being?
I don't know whether people, even doctors other than psychiatrists, realize it. But sexuality is the core of a person's personality. It's an indispensable part of a person's personality. See, whether the person realizes it or not is different, but sexuality is the core of a person's personality. So a sexually healthy person, how do you identify a sexually healthy person? He interacts with all genders meaning the male, the female, and the transgender in a socially appropriate and respectful manner. He feels free to ask relevant questions on sexual health without inhibitions. He is able to communicate positive sexual desires in socially acceptable ways. He is able to refuse sex when not interested without feeling guilty or hostile. And he can express sexual attraction without exclusive attention to the genitalia. He feels free to establish and enforce boundaries in sexual and also reproductive relationships. So he always understands and respects the sexual boundaries of others too, not just his own, but others too. And he has the capacity both to give pleasurable sexual experiences and accept pleasurable sexual experiences, of course consensual is important. So sexuality helps a person get a sense of self. That's a psychological term. So sexuality helps him get a sense of self. So, sexual and reproductive health is the core of a human throughout life. A person may be 50 years old, 70 years old, 65 years old, but still sexuality plays a part. So, it encompasses gender identity, gender role, orientation, intimacy, pleasure, and reproduction, of course. Sexuality is expressed in thoughts, in his or her relationships, behaviors, goals, value systems, attitudes, beliefs, desires, and of course, fantasies.
So,
So,
so overall, like you
and
said, that
also I have something more to add. So, shall we shorten it to SRH, sexual and reproductive health?
yeah,
So,
yeah.
SRH gives a person a right to information on sexual health as well as continuing education on advances in this sector. There are a great deal of advances going on in this sector because I attend the conferences on sexuality. I know how much, but in SRH gives a person the right to information on these advances, yeah, a right to privacy. I mean, that is very basic. A right to decide whether at all to have children. That is a reproductive right. He can choose whether to have children, she to have children or not to have children, how to space them, and the number of children he or she. SRH, when I say he, it also means she. So SRH protects the rights of the self and also others to express and enjoy sexual health without stigma,
Mhm.
barriers, or discrimination. So human sexuality is lifelong. You may live till 90 years, but till that age, till death, human sexuality is lifelong and it is a normal part of biological, emotional, psychological, and social health
So overall, it plays a very crucial role in a person's health and
and
like
personality.
and personality. And like you mentioned, gender identity. That concept is, I feel, still very new in India. The LGBTQ plus community
Yeah,
is slowly getting their rights and their recognition in our community.
yeah.
So, with respect to that, what do you think is the current status of sexual reproductive health, its access in India?
I mean, to be very honest and brutally honest, it's dismal in India. And it's poor everywhere in India. I mean, not just in South India where I live. It's all, I mean, I've traveled all over India in most states, and it's the current status of SRH is very poor in India. So, I mean, what are the indices which tell us that SRH is poor in India? The high rate of unconsummated marriages, which don't approach a medical therapist. I mean, it's not the case in Western countries. I mean, I've had people who have had unconsummated marriages for 20 years. After 20 years, they come to a doctor. After 15 years, after 10 years, even doctors come as like that. So these are the indices with which I measure SRH, and then the prevalence of sexually transmitted diseases. So, I'm a government doctor. In the 1990s, I used to organize STD camps in villages, very remote villages, where you wouldn't find even a proper road. I mean, not a proper road. There wouldn't be roads. You have to travel through bushes. And
Mhm.
I used to organize STD camps in those villages in the 1990s. The males were treated by me, and I invited a female doctor and a secluded place, another place, designated place to treat lady patient because it's a village, it's a conservative village. Why do I say SRH is poor in India? We used to organize STD camps in villages, and I mean the turnout was massive. The lady doctor told me 70% of people in this village, I won't name the village because of stigma. It's a village in Tamil Nadu. 70% of adults in this village have sexually transmitted diseases. And she treated lady patients, and I too found that the same 70% of the male population, adult population of that particular village had sexually transmitted disease, and we treated them successfully, and we also gave them sexual education on how to prevent sexually transmitted diseases. So don't think that STDs are more prevalent in urban areas than rural areas. The converse is true. The STDs in India, let me tell you from my long years of experience. I'm relating from 1990s. So STDs are more prevalent in the villages, and that is one index that tells us the poor state of SRH in India, the poor penetration of SRH in India, and of course the maternal mortality rate, the widespread practice of sexual quackery and the thriving sexual quackery mafia that I find in Tamil Nadu. It must be the same in other states too. So, but why do people go to sexual quacks? Because there are no sexologists in these villages and semi-rural areas and small towns. If you go to Chennai or Mumbai or Pune or Kochi or Jaipur or Chandigarh or Delhi or Kolkata, you will find a lot of sexologists. But there is a skewed pattern. I mean, sexologists, overall sexologists are lacking in India. I mean, by sexologists, I mean psychiatrists, urologists, and gynecologists who have undergone training in sexual medicine. So overall, there is a lack of sexologists, and even those sexologists prefer practicing in cities for their own reasons. So there's a skewed distribution of sexologists in India, so that these rural people, when they have a sexual problem, where will they go? There are no almost no sexologists practicing in rural India and semi-rural and towns. So that is why the quacks make a killing there. I mean, they make not lakhs but crores of rupees, millions of rupees selling. One person told me a quack gave him a bottle of some ointment and said, "This is 30,000 rupees. Just consume it. Your ED will erectile dysfunction will disappear." Of course, it didn't disappear, and he came to me, and I just prescribed him a simple tablet, and he was able to have a proper sex life. Uh, these are some of the indices that I use. So the widespread quackery in India, and the stigma associated with patients, and the stigma that is not talked about is the stigma associated with doctors who specialize in sexology, like me. So in my sexual health clinic, there's a gynecologist, myself, a urologist, and a psychiatrist. We form the team who's one day we just not one day, on many days we go to the street end to have a cup of coffee. We are always called sex doctor vanditaru in Tamil. So they don't call us doctors. They don't call me a urologist or him. I am a urologist in government service. My friend is a retired HOD of psychiatry from government service. He's much older than I am. He's at least 15 years older than I am. So he doesn't call him a psychiatrist. He's a sex doctor. So and one time, we used to go out for snacks in hotels. In one hotel, the hotel owner was sitting at the bill counter. He said, "You're sex doctors, no?" Psychiatrist and I usually go out. And he said, "Here we only allow cultured people to come in. You are sex doctors, please get out. This is a place where respectable people, so respectable." So we were not considered respectable because we are sex doctors, and we had run a sexual health clinic. There's a large board saying sexual health, and he asked us to leave the place, and we were very shocked. My psychiatrist, of course, maintains equanimity in all situations. Just come on, Jason, we'll leave. And but I found it very difficult. We are not allowed to get into an Indian hotel in an Indian city, in my own city, just because I practice in this subspecialty of urology. And one thing more, we offer the best salaries for female nurses and the gynecologists who practice with us. But you know how difficult it is to find a lady gynecologist to practice in a sexual health clinic. We offer the best. I mean, I know the prevailing rates for gynecologists in Chennai, but when we offered, we even offered double the amount. But one retired gynecologist say, "Sir, I am a respectable woman. I am a respectable woman. How can I practice sexual medicine?" I mean, I told her, I mean, your role is examining lady patients and writing relevant information. Sir, I am respectable. I come from a respectable family. I have a daughter to get. I mean, I am going to marry off my daughter. Who will marry my daughter if I work in a sex hospital? This was a government gynecologist who had just retired who told me. So whenever a gynecologist leaves a clinic, we find it very difficult to get another female gynecologist to work in a sex clinic. They are willing to work in a gyne clinic, but not in a sex clinic. And we want lady nurses to handle lady patients. So 10 years back, I mean, the situation has changed a lot now. 10 years back, we used to give advertisements in the papers, and from the window, I used to see the nurses. There are plenty of nurses in South India. I mean, and we offer the best salary in the business among hospitals. We will find a young nurse coming with her father to through the window. I would see from my first floor. She would come in, she would see sexual health clinic, and then just walk away. One after another, after another, after another. This was 10 years back, around 2012-13, but things have improved now. But still, the stigma is there. So the stigma is not just associated with the patients, it is
Mm.
also associated. There is a stigma that is stamped on us also. I mean, caregivers, I mean, the therapists also. And even the general public is afraid. I mean, half the patients who have attended my clinic have said, "Doctor, we've been trying to come here for months or sometimes years. We know you are here. We know you treat sexual disorders, but the problem is you have sexual health clinic written boldly and illuminated on your this thing at your place. If somebody sees me at entering your place, what will they think? They'll think I'm a sex patient. I mean, how can I bear this insult? I mean, with sexual getting treated for sexual health like erectile dysfunction or premature ejaculation, these are diseases. I mean, you get a clogging of arteries in your heart and you get a heart attack. Do you get a stigma? Even I'm a heart attack patient. I mean, there is no stigma associated. The same blood clogging of arteries occurs in your genitalia and you get erectile dysfunction, but that is considered a stigma. So, I mean, just look at, I mean, these are not poor people. These are very well educated people who said these. I mean, doctor, we waited for years before coming here because nobody should see me entering this place. Your clinic is in a prominent place and you have all kinds of illumination. And uh, so, how can I come to your place? That is why I delayed treatment. And that is why sex quacks they don't put all these things. They give
Mm.
paper ads and newspaper ads, and they are able to make money. So they don't put all these sex doctor these things. They give newspaper ads, and then they quietly ask them in and get lakhs, thousands from 30,000. The minimum rate was 30,000. From 30,000 to several lakhs, they demand, and people are willing to give it. So they prey on the insecurities and sexual semi-literacy and of the patient and the societal and familial pressure to have babies after marriage. I mean, we were talking about reproductive health, and if you have time, I'll tell you an anecdote. In the government setup, I had an assistant, a nurse, a senior nurse, was very punctual with me. And one day, I mean, every day she used to assist me with cystoscopy. There is a procedure called cystoscopy that we do in urology. And one day she was absent. And I asked her, I left it at that. But after 2, 3 days, I inquired, why is this nurse has never taken leave? Where is she? And I was informed that she has been arrested by the police. She had, uh, I mean, the reason was she had pressurized her daughter-in-law to get a baby, and the daughter-in-law had committed suicide, and leaving a letter saying that I am committing suicide because my mother-in-law is pressurizing me to have a baby. She's calling me a maladi, meaning in Tamil, it's a Tamil word which means a barren woman. So this is the reason why I am committing suicide. Actually, this girl who committed suicide was my patient. I had I had done a pyeloplasty on her, and she was a very learned lady, some BTech or MTech. So she died. So that is the kind of societal pressure to bear a baby after marriage, and they think there is no male factor involved in infertility. So when there is infertility, people only blame the bahu or the daughter-in-law. So they are not conversant with male factors in infertility. So if there is widespread access to doctors qualified and trained in sexual health, this would not be the case, isn't it? So this is frankly, to be brutally honest, I find SRH, meaning sexual and reproductive health, to be very dismal in India currently, even today, as we speak.
So you mentioned a lot of problems as well, starting right from the cultural issues to even lack of awareness, even in the most educated people. Sexual health still forms a very low awareness level in these people. And again, the stigma, not just with the people, with the doctors and people trying to attend the clinic also feel very stigmatized. And this whole recent lot of news has come up about contraceptive accessibility in Tamil Nadu, especially in Chennai, where contraceptive pills are not available in pharmacies, and women find it very difficult to access these contraceptives, oral contraceptives. Something which I have not been to Chennai and faced, like spoken with anybody in person. Anything you have faced in your practice related to this?
No, I am not facing such issues in practice. Anyway, government hospitals are there where we have ample supplies of contraceptives, and we give them discreetly and in sufficient quantities. So, at least in the government sector, I'm not facing these issues.
Okay.
I've actually never faced these issues in the government sector.
Okay. So you have mentioned a lot of barriers to good sexual reproductive health in the country, starting right from stigma to awareness. How do you suggest, since you've been working with the government, how do you suggest we can address these issues, whether it's at the policy level or people like me who are just physicians in the community? How for each person, what can be done according to you?
We can, the government can start with good sexual education. The sexual education of the girl child is very important. So when I was studying, when I was in school in the 1980s, we had a chapter on sexual education. But we were never taught. Naturally, as teenagers, we were inquisitive about this taboo topic. We had this very good, nice diagrams about the male genitalia, the female genitalia, menstruation, this, that, and all this substance, which was all new to us. We were school students. But our biology teacher, we asked him, sir, you're skipping these topics, lesson 11 and 12. Sir, can we discuss these things? I was an interpret student. I used to ask him. But what he said was, questions will not be asked on this topic in this thing in the exam. So let us not discuss this. This is a taboo topic. Let us not discuss these in because it's useless. Because that this is the word that he used in Tamil. I'm just translating it. This is a useless topic. Let us not discuss it. This was in the 80s when I was a school student. Recently, a man came to me with a sexual problem. Though he was educated, he was from a village. He lacked basic. He was just married and had a sexual problem. And I just asked him. Did you have biology? Go through biology classes? Yes, he said. And were there chapters on sexuality, sexual organs, normal sexuality? And yes, there were chapters. And did your teacher explain, biology teacher, he said the exact almost after all these years. I mean, where is 1980s and where is 2023? We are in 2023. In 2023, the man almost exactly described the same words that my biology teacher said in 1980s. That man is, this patient is saying even today. So even today, sexual education remains only on paper. It is in the syllabus, it is in the curriculum, but it is not taught in the school, neither in government school, not in private schools, not in the rich schools, not in the poor schools. There are various kinds of schools, no. So this is still a taboo topic. So I want uh, people to be educated rather than getting wrong information from peers or some other source. I would like teachers to be involved in this thing, sexual. Sexual advice. And I would make sex education mandatory. If I had the power, I would make sexual education mandatory from high school level to college level in all schools and colleges in India. And I would invest in universal HPV vaccination in the adolescent female. So you would have heard about human papilloma virus vaccination. See, the second most common cancer in India among females, the first is breast cancer, the second is cervical cancer. Among Indian females, 22% of cancer patients are cervical cancer patients. So if the government is willing to invest in more universal HPV vaccination of all adolescent girls in India, I mean, you catch them in the schools, or I mean, non-school going girls also, the VHS, village health nurses can cover. If you do that, you can prevent most cases of cervical cancer, which is endemic in India. I mean, like I told you, the statistic, 22% of female cancers in India are cervical cancers, next only to breast cancer. And I would try to remove stigma from, if I given the power, if you make me the president of, or I mean, give me some ministership, I would try to remove stigma from sexual health disorders by repeated education. I mean, tell them that a problem like premature ejaculation or erectile dysfunction is only a health issue, not a taboo topic. It's like a heart attack, like, one which I suffered, or a stroke, or I mean, or some Parkinson's disease. You don't attach a stigma to Parkinson's disease or a heart attack or a stroke, or I mean, whatever, or an accident. So why do you attach a stigma to sexual health disorders? These are also disorders of the human body. So these can be corrected. So if you give me the power, I will try to remove. I will invest in IEC programs to remove stigma from sexual health disorders. I would, in reproductive sector, I would make institutional deliveries compulsory. I mean, if you, I don't know whether you have time. I mean, there are many people. I mean, recently, around 3 months back, a corporation gynecologist asked me to visit a place where there had a metal death had happened at a house. The husband was a sub-inspector of police. She just asked me, could you come with me? She's the corporation gynecologist, Corporation of Chennai. And I asked the sub-inspector, why did you not go to, I mean, the next, the adjacent hospital is a very famous government gynec hospital is nearby, where every facility is offered by the Tamil Nadu government free of cost. You are a sub-inspector of police, going to be elevated as an inspector of police. Why did you have your wife get delivered at home by your mother? He said, my mother gave birth to me at this home. My mother was delivered by my grandmother here, and this has been my family practice. So why should I go to an institution for something as simple? This was the word he used. Something as simple as delivery. He doesn't know about the complications of delivery like a gynecologist. And the gynecologist and I discussed this for long after. If this is the attitude of a sub-inspector of police in Chennai, I mean, what would be the attitude of an illiterate person? So I would make institutional delivery is compulsory for everybody. And if you give me the power, I would give, I would may, invest in government-funded programs in sexual education, not just in schools, but in panchayats. I mean, lady panchayat leaders can call a group of ladies and give basic sexual education, basic physiology, pathophysiology, basic diseases, how to prevent them, safe sexual practices, and all that. And I would invest in education and distribution of contraceptives. And I would enforce the right to healthy adult sexual gratification as a fundamental right. So, to me, a sexologist who is invested in sexual health of the public, at least to me, this is a right to say sexual gratification is a fundamental right. I regard it as that. I would strive to make it mandatory. Sexual health should be, sexual gratification should be mandatory for every adult, as he or she pleases, subject to laws, of course, the law of the land. And I would utilize the lady teachers and nurses to educate adolescent girls on basic sexuality, pregnancy, and sexually transmitted diseases. And I would implement gender sensitization program. You know, for government officials, see, I'm a urologist, a government urologist. I go to government, I mean, the gynecology wards frequently. There is a call over, and I find, I mean, the rape cases come from the forensic medicine department. The 15-year-old or 14-year-old girl who has been raped by a 40-year-old man comes to the gynecology department of a hospital. Do you know how she's treated? She's treated like rubbish, trash. I mean, unwanted person. I mean, not always. At least 10% of police women treat them like rubbish. Hey, Ngavadi, Angpodi. I mean, this is not, I mean, she may be rich, she may be poor, she may be literate, she may be illiterate, but she is a human being and she has been traumatized sexually. And recently, this is not the way to handle a sexual assault patient. And even 10% of I'm not, gynecologists are excellent people. I'm not blaming them. At least 10% of gynecologists don't treat them properly. They make them wait for 1 hour or 1.5 hours. Say, I'm busy. I mean, say, madam, that girl is waiting for a long time. I'm busy, doctor. And they also, I mean, at least 10% of gynecologists treat these rape victims, alleged rape victims badly. So I would implement gender sensitization programs for government officers. And I would pay higher salaries for sexually trained psychologists, urologists, gynecologists, and offer them incentives to go and work in rural areas where their services are needed. I mean, I told you about my experience. I'm very, very sure what held in true in the 90s also was true in 2023. STDs are much more prevalent in rural areas of India than urban areas. So we need more sexologists in rural areas who are committed to public health. And I would give, I mean, what would make them go there? Give them financial incentives. I mean, a lot of financial incentives, and maybe improve the infrastructure of villages so that these people, sexologists, will, at least some of them will go and work in rural, semi-rural, and small towns, so that their qualified sexologists care is available to every Indian. This is a basic right. I mean, in my opinion, see, I'm a sexologist. I will speak only from my point of view. So I will invest in these things to give a better sexual health to the population of India.
Just to summarize what you have said, the main crux of that discussion still comes out to be education. Education starting right from the school level.
High school.
From high school level till, in the adult and till your professional level as well.
Yeah.
So education ultimately forms the core of addressing this problem.
Yes.
Besides working on increasing human resources for sexual health and making sexual health a right to access and a right for every person in India. And like
removing stigma as well.
Stigma as well. So I feel with the education itself, once the conversation starts around this issue, the stigma will get addressed on its own. And like you
Yes.
rightly said, the more in sexual transmitted diseases are more in rural versus urban. And if we look at the NFHS data from the NFHS 5, we see that condom use was only 7.6% in rural India compared to
That is the problem.
only
I mean,
13% in.
cracking the whip on my, I mean, I used to crack the whip on my health inspectors to distribute more condoms and all these things. But I
Mm.
mean, they have their own unions and they give all kinds of reasons for not distributing condoms and all these things. So, I mean, the penetration of, I mean, first education about contraceptives and
Mm.
distribution should be more in rural areas.
And I feel there are few people now who are actively working to address this issue, at least at the individual level. For example, there's Dr. Tanya, who's famously known as Dr. Cutress on social media.
Oh, I've seen her in Twitter. I mean, I think she follows me. Tanya, also known as Twitter. I mean, she wrote
Yeah.
on sexual health. I wondered what her degree would be, and I've seen a lot of her tweets. I don't follow her, but I think she follows me. I mean, is she a sexologist? I mean, a gynecologist with you? I mean, or
No,
somewhere
no,
else?
she's not with me. I've just seen her on social
She
media.
nice, writes nice tweets on
Yeah, so I
this
just
topic,
just wanted
taboo
to give
topic.
a shout out to Dr. Cutress. Like she has really good content on sexual health online.
Oh,
So
then I'll start following her. Yeah, okay.
somebody watching this video can definitely get some information from there as
Yeah,
well.
I've read some of her tweets. They were excellent. I mean, God bless her.
So just my last question to sort of end this whole discussion. Do we have any role models to follow as of now in India or beyond India? Um,
In India, we don't have any role model to follow, sir. In Tamil Nadu, I mean, I will be brutally frank. There is no role model to follow. I mean, the sex, at least the sexual health part is I mean, not okay. I have some awareness about Kerala. Even in Kerala, we are. I mean, sadly, there is no state in India that I know of. I've traveled except Meghalaya, Tripura, and Mizoram. I think Arunachal Pradesh as well. I have traveled every state in India, and I have found SRH to be dismal in every state in India. So we don't have role models in India, but we have role models in Western Europe and North America. So what is different? My friends and my classmates work as doctors there, and what they point out is that there is universal sex education from high school level, and there is, I mean, it's not a taboo topic at all. I mean, a girl can stand up in a co-ed class and ask the most intimate question without, I mean, even anybody even just reacting or looking at the face. There is universal sex education there. There is access to genuine medically written sexual health materials, not I mean junk written by all these rubbish porn magazines or something like that, or the peers. I mean the peers tell you all kinds of rubbish about sex. I've heard patients say all these things. So they have access to medical literature on sex. They have a universal institutional delivery in Western Europe and North America, and near universal knowledge of contraception. Even a school-going girl or a boy knows the is contraception literate there, and there is lack of stigma associated with sexual problems. A man will come to a lady urologist and say, "Ma'am, I have a problem with erectile dysfunction," and the conversation will be very professional. There is absolutely no stigma. He will come in daylight. He just arrive in his car, park it, come inside, and get a solution, a prescription, or prescription plus advice, and go back. There is no there is very little stigma associated with the sexual problems in Western Europe and North America. And there is no stigma around sexual orientation, much less stigma around sexual orientation in these countries. There is parental involvement in sex education, not just teachers and these government officials. Parents themselves teach basics. Once their ward is adolescent, there is greater parental involvement in sex education in the countries that I told you. And there is a healthy and vibrant discussion and discourse on sexuality and better gender education and sensitivity of government officials. I mean, they said, I mean, I described all these things. I mean, some at least 10% of female constables and 10% of obstetricians do not treat these people properly. And they said this is I've never seen, almost never seen such a case. We are do offer gender sensitization programs to government officials. It's compulsory, attendance is compulsory, and they are gender sensitized to how to handle these people. And there are state granted rights to express sexual orientation. You can tell, I mean, you can fill up forms saying that I am lesbian, and they won't bat an eye. They won't treat you like, aha, nothing. You can write, I am bisexual. You can write, I am a homosexual male, and they will not treat you differently. So this is something exemplary that my classmates and other friends who are practicing in UK and other Western Europe countries and North American, Canadian doctors and American doctors told me this is a model that can be emulated in India. All these things can be done in India as well. So my hope, I mean, my wish is that as a person, as a urologist who subspecializes in sexual health issues, I would like these to be implemented in India.
So from this conversation, one thing is clear, that we have a long way to go. And
that's correct. That's correct. That's correct. That was the point I wanted to convey. If this point gets through, I'll be very happy. We have a very long way to go, and we need committed individuals like you, Dr. Parth, take this forward, and Tanya ma'am and other people. I mean, Twitter, I found a lot of people, and it is me who is writing on Twitter. Let this be clear to everybody. It's me, Jason Philip, or all called Jason Philip. In official documents, it's Jason Philip. I write those sex articles in Twitter, and people write he's writing pornography. I have never written pornography. I mean, what is my age? I'm beyond 50, so why should I write? I mean, you think I'm writing pornography? Being a government official, senior government official, I'll write pornography in Twitter. I have time to write all these things. I'm trying to educate the public on sexuality. These are the sexual issues prevalent in India, and I mean, even some doctor patients have come to me without absolutely no knowledge of premature ejaculation, or I mean, the causes of erectile dysfunction. Doctors, postgraduate doctors have come asking for divorce, and I gave just a pill for premature ejaculation, and the issue of divorce was closed in 10 days. So I want committed people like you, Dr. Tanya, and other people to get involved, especially youth. I mean, you're a young man. The other persons also in your team must be young. I mean, the future belongs to you, and if you invest in public health, God will bless you, and the people of India will certainly bless you.
So this is the whole hope and aim with Nivarna as a public health platform in India, where anybody who needs any public health information can just go to nivarna.org, and they should have access to all scientifically relevant information in a single place, and not any quackery. So thanks a lot, Dr. Jason, for joining us.
It was a pleasure talking to you. I mean, somebody on the same wavelength as I am. It was a great pleasure being in the program.
Thanks a lot. And we hope that people watching this video have learned something. And if there are any doubts, I'll share Dr. Jason's Twitter handle in the description of the video. You can reach out to him. You can reach out to me, and I can also connect you.
Yeah, if they reach out to you, I mean, I will always. They can just tag me at Jason Philip 8, and I just ask their questions, and they can. I will always answer a genuine question to the best of my abilities. I mean, this I promise openly on YouTube or on your program. I will always address them.
So thanks a lot once again, Dr. Jason. And I hope you have a great week ahead. And I hope we can do something useful together in further projects as well. So thanks a lot for joining me today.
Thank you.
Have a good day. Thank you, sir. Bye.